Hello guys, welcome back to A to Z Dentistry, and today we will be discussing about hairy tongue in detail. So without any further ado, let's get started. So basically, hairy tongue is also known by many other names. So these are some of the synonyms which are used for hairy tongue. That is, it is also known as lingua nigra, lingua villosa, nigra, lingua nigra, and black hairy tongue. Now, if we break these words down, that is lingua nigro. Lingua means tongue, okay, and nigro means it basically refers to any shade or any particular color which often has a very darker shade, okay. So lingua meaning tongue, and nigro here basically means the tongue has acquired a somewhat darker shade, right. It may range from grayish black all the way to brown and black color. Now here it is also known as black hairy tongue. Black because of its color, hairy meaning that the surface of this particular lesion basically appears like hairs, okay, like strands of hair. Now we will learn about this in detail in the upcoming slides, why we have used the term hairy here, okay. So now let's try to get a brief idea of what exactly this term hairy tongue means. So basically this hair is nothing but it is the overgrowth of the filiform papillae on the dorsum of the tongue. Okay, now what happens in this condition is that there is an overgrowth or hypertrophy of the filiform papilla which are found on the dorsum of the tongue, right. We know that filiform papillae are the most numerous papillae which are present on the dorsum of the tongue, and when there is ineffective mechanical debridement, okay, when there is an improper or compromised oral hygiene, what happens is that due to lack of surface debridement, this filiform papilla increase in their size, they get hypertrophied, and that gives the appearance of the hair. Therefore it is referred to as black hairy tongue, okay. Also it may be associated with a delayed shading of the horny layer, that is the surface stratum corneum, right, which is the conified hair which has a layer of keratin. Now what happens is that if at all there is a delayed shading of the cells, or the keratin particularly tends to accumulate over the upper layers, okay, and gradually the thickness increases, and this gives the appearance of a matted layer on the surface of the tongue. Also it has been proposed that in some cases there may be an increase in the rate of keratin formation. Now one can imagine that if there is a continuous deposition of keratin, gradually what will happen is that the thickness of the upper layer will increase, okay. Now this thickness will give the appearance of strands of hair, therefore it is known as hairy tongue. Moving on to the etiology or the various causative factors which are responsible for this particular condition. The number one cause or the primary cause is poor oral hygiene, or lack of mechanical debridement, or lack of surface stimulation over the dorsum of the tongue. Now basically this condition is associated with those people who either have an improper oral hygiene or a complete lack of oral hygiene, or people who do not use tongue scraper as a tool in their routine oral hygiene practices. Now what happens is that the tongue scraper basically functions to remove the accumulated surface debris and also the keratin, okay. As we have discussed previously, there is continuous accumulation of keratin over this filiform papillae, and the tongue scraper basically functions to remove all these debris and keratin and whatever which has been accumulated over the surface of the tongue. Now if a person does not use such kind of aids, then gradually it leads to oral hairy tongue. Other cause is radiation therapy. Now this radiation therapy is particularly indicated in patients who are diagnosed with cancer, right. So extensive x-ray radiation around the head and neck region may also lead to hairy tongue. So apart from these two factors, other factor is after surgery. Now what happens is that whenever there is a case of maxillofacial fracture, as a part of treatment planning, the patient has to undergo intermaxillary fixation. So, irrespective of the method for IMF, that is either it may be eyelet wiring or multiple loop wiring or arch bars, but there is a compromised oral hygiene. Because of those wires, the patient is unable to maintain proper oral hygiene, and as we have already studied previously, poor oral hygiene or lack of oral hygiene is basically a very important causative agent for hairy tongue. Another important causative agent is the lowered pH of the oral secretion. Now, here this oral secretion basically refers to saliva. Now, we all know that 5.5 is regarded as the critical pH of the saliva, and below this pH, that is in an acidic environment, it leads to demineralization and there is a net loss of calcium and phosphate from our enamel, right? So, we don't need that kind of environment. And likewise, apart from precipitating dental caries, this kind of acidic pH also affects the desquamation of the surface layer, right? Or we can say it affects the turnover rate of the oral epithelium, and it might lead to defective desquamation, which might precipitate hairy tongue. Another causative agent is presence of any debilitating disease. Mainly this refers to diabetes mellitus or any other chronic disease, right? Now what happens is that in chronic disease, particularly if we take an example of oral submucous fibrosis, we know that there is a compromised tongue movement, and in very severe cases one might also observe ankyloglossia, right? There is a very limited tongue movement and there is a marked decrease in the tongue mobility, which mainly precipitates improper oral hygiene and again may lead to hairy tongue. Other causes foods. Now various foods which have high amounts of colorants within them may precipitate the surface color which we are able to see in such kind of lesions. Many candies, right, many colored candies can lead to any kind of coloration ranging from orange to dark brown all the way to black. Apart from it, mainly from coffee and tea, such kind of discoloration may be implicated. But the point to remember here is that the tea and coffee, or for that matter any beverage, is not in itself responsible for this particular condition, right? Consumption of tea and coffee is not associated with hairy tongue. However, the color, right, the brownish or blackish color which we see, that is because of this tea and coffee. Now what happens is this: there is already a hypertrophy of this filiform papillae and these are functioning like strands of hair. Now what happens is that due to the surface overgrowth, anything which we consume tends to become entrapped within these structures, within these hypertrophied papillae. Now the colorants which are present in such kind of beverages and candies, they get accumulated over this filiform papillae and that gives the blackish or brownish appearance. So I hope I have made it clear that not the tea and coffee are directly a causative agent for this lesion, but the surface color, right, it is mainly implicated to the consumption of such kind of beverages. So another etiological factors include overgrowth of any fungi or bacteria. Now particularly in fungus group, it is implicated to this Candida albicans species. Now we know that it is a very common kind of fungus which is mainly responsible for various kinds of oral lesions which we study, right? So now whenever there is an overgrowth of the Candida albicans or certain chromogenic bacteria in the oral cavity, this might lead to this hairy tongue. Apart from it, Candida species is mainly associated with the burning tongue, right? Now this burning tongue is one of the symptoms of this hairy tongue, right? So because of the overgrowth of this Candida species, it might happen that the patient complains of burning sensation on the tongue. So apart from this cause, use of certain drugs has been implicated to this lesion, mainly sodium perborate, sodium peroxide and certain antibiotics, particularly the penicillin group and the aueromycin group. Now let's move on to the clinical features of hairy tongue. So the first point here is the site. Now this lesion particularly involves the dorsum of the tongue, right? And within the dorsum of the tongue, it is particularly seen in the middle region or the posterior one third of the tongue. Now within this two, the posterior one third of the tongue is the most severely affected site, right, within this lesion. Second point here is the various signs, right? So there is obviously hypertrophy of the filiform papillae, and these papillae may reach a length of approximately 2 cm, right? And in some cases one can easily elevate this papillae with the help of any dental instrument. Now, as I have already told you that these filiform papillae basically resemble like strands of hair. Now, one can easily catch hold of the hair. Likewise, with any dental instrument, we can easily move these structures, right? Moving on to the symptoms. So basically, patients with such lesion frequently complain of a tickling sensation in the soft palate and the oropharynx, particularly during swallowing. Now, this is mainly implicated because of the overgrowth of this filiform papillae, right, which tend to contact the soft palate during various masticatory movements, and therefore it may lead to a tickling sensation. In very severe cases, patients may actually complain of a gag like sensation. Okay, now the main problem associated with this is the retention of the food particles and other food stuff and other colorants, right? As I have previously told you that there is an overgrowth of this filiform papillae, right? So basically various food materials, food particles, and whatever the patient consumes tends to get entrapped within these papillae. Now this leads to the halitosis or the bad breath, right? Apart from this, other sensations is tickling and gagging, right? As previously I've told you. And when such a lesion becomes complicated with a secondary candidal overgrowth, right, candida albicans, when superinfect such kind of lesion, there is a burning sensation. Now this is also known as glossopyrosis. Moving on to the appearance of hairy tongue. So basically, as we know that there is elongation of the filiform papillae. These elongated papillae impart a kind of hair-like appearance, therefore the name hairy tongue, right? The hyperplastic papillae eventually become pigmented due to variety of food consumption, especially tea and beverages, right? So the papillae take up the color of such substances and appears black. Apart from it, certain chromogenic bacteria may be responsible for such an appearance. Apart from black, the tongue may also appear brown to yellowish in color. And this coated appearance not only gives it its characteristic feature, also it leads to retention of oral debris. Now, because there is a hyperplasia of the papilla, right? So eventually, whatever the patient consumes, some part of it gets entrapped within these structures, and this leads to halitosis. Moving on to the surface of the hairy tongue. Now the surface may appear brown, white, green or pink as previously discussed. Now these colors are basically there because of some or other kind of specific etiology or many secondary factors such as use of colored mouthwashes, mints, chocolates, beverages like tea and coffee. So depending upon the kind of product the person is consuming, right, the appearance of the tongue may vary from yellowish to brown to blackish in color. Moving on to a separate entity which is known as Urdhitang or Urdhitang. Now, as the name explains itself, this kind of thing or a lesion is basically something which appears as heavily thickened or a matted kind of layer over the dorsum of the tongue. Now, this kind of a lesion is usually seen in patients who are chronically ill, right, and such kind of patients who are dehydrated over a longer period of time, or patients with a lot of comorbidities. So a thickened layer tends to get accumulated over the dorsum of the tongue, which appears as a leathery coating, right? Now such kind of a lesion is usually very heavily coated with numerous bacteria and fungi, and also there might be very extreme kind of halitosis present, right? So if such kind of appearance is seen clinically, then we might suspect some or other kind of systemic disorder as well in such patients. Moving on to clinical diagnosis. Now, basically, because of its characteristic appearance, one might easily identify such kind of lesion, right? So, basically, due to overgrowth of the hyperplastic papillae, there is a characteristic clinical appearance, right? Hair, the papillae will assume a hair-like appearance. Apart from it, there is a characteristic coloration, that is, it might appear brown or blackish in color. So one can easily differentiate between any other lesion and hairy tongue. Moving on to the laboratory diagnosis part. Now basically this kind of lesion there is already, we have learned that there is overgrowth. Now basically in such cases, one remarkable feature is there is hyperkeratosis. Apart from it, there is elongation of the papillae, and inflammatory cells may be present. Usually neutrophils are present in such cases. Now whenever in doubt, we must always go for a histopathological diagnosis. Moving on to the differential diagnosis, now this lesion must be differentiated from other conditions, especially candidiasis, leukoplakia, oral lichen planus, and oral hairy leukoplakia. So the first differential diagnosis which one would want to consider here is that of candidiasis. Now basically candidiasis appears as a whitish pigmentation, right? And obviously when we will send a specimen for histopathology, definitely there will be candida hypi present, so we can easily rule out candidiasis. Second is leukoplakia. Now basically leukoplakia is a non-scrapable patch, right? And in cases of leukoplakia, we also find some same kind of lesion present of buccal mucosa or corner of the mouth, right? But oral hairy tongue will be always present on the dorsum surface of the tongue. Then in cases of oral lichen planus, we can easily differentiate it, because in case of oral lichen planus, we'll find Wickham's striae, and lichen planus is usually bilateral, right? It has a characteristic pattern. And apart from it, as we can see in the last picture, these lesion will give a appearance of reticular pattern. There will be a striae radiating from a centrally umbilicated area, and also these lesions, their color might range from white to yellowish white to a deep erythematous areas intermingled with whitish areas, and also some lesions may give a violaceous hue. So such features helps us in distinguish it from oral hairy tongue. Moving on to the last differential diagnosis, that is the oral hairy leukoplakia. Now many of the students get confused between hairy tongue and hairy leukoplakia. Now hairy tongue is not a pre-malignant lesion, right? It is not a pre-malignant lesion. However, oral hairy leukoplakia is a pre-malignant lesion. Now one must understand that the etiology behind both these entities is completely different. Oral hairy leukoplakia is caused by Epstein-Barr virus, and this is also hallmark for HIV positive individuals, where such kind of lesion is seen along the lateral borders of the tongue, and it is present bilaterally. However, hairy tongue is present on the dorsum surface of the tongue, right? And it will never involve any other part of oral cavity apart from tongue. The name itself indicates that this lesion is particularly restricted to the dorsum of the tongue. So it is very important to differentiate between these two lesions. Moving on to the management. Now basically the first thing here which we would consider is maintenance of oral hygiene. Now, as we have already clearly discussed in the etiology, that due to improper mechanical debridement of the tongue, oral hairy tongue occurs. So basically brushing of the tongue twice daily for 2 minutes by making gentle movements or strokes over the involved area, right? Now this kind of oral hygiene routine might help to prevent hairy tongue. Apart from it, we must focus on eliminating the predisposing factors. We might ask the patient to stop the consumption of certain candies or gums or whatever he or she is consuming, which will lead to halitosis or the characteristic correlation of hairy tongue. So apart from this, we prescribe the patient with topical keratolytic agent. So basically topical keratolytic agent such as podopylium and acetone is given to such patients, because we know that there is hyperkeratosis. So we need a agent which can debride the surface of the tongue by removing the hyperkeratotic cells from the surface layer. Apart from it, if the modalities previously discussed fail to heal the hairy tongue, then we go for the surgical removal of the papillae. Now it is usually done by electrodesiccation or by means of carbon dioxide laser, or removal with the help of scissors, right? The traditional surgery which we undertake in such cases. Apart from all these methods, we must advise the patient for a comprehensive oral hygiene. The patient needs to be counseled regarding the mechanical debridement of the tongue daily by means of tongue scraper. This is very important because we want to control the hyperkeratosis which is happening, right? So mechanical debridement of the tongue is very important. Apart from in maintenance of proper oral hygiene is also very helpful in such cases. So this was all about hairy tongue. I hope you all understood this video very well. Keep sharing, keep subscribing, and don't forget to comment. Thank you. See you next time with a new topic.